We are going to move to our last session of the day, sponsored by ConnecturRx, how digital engagement is taking the member experience to new heights, insights and results from the voices of the Medicare consumer and agent surveys. With us, we have two speakers. Jeff Schmidtkins is an account executive with ConnecturRx, and Amanda Woodman is health plan sales executive with ConnecturRx. So without further ado, I'd like to hand it over to our speakers to get started.
Excellent. Thank you. Good afternoon, everyone, and thank you so much for taking the time to be with us today. Just let the slide get in presentation up. There we go. Health plans realize they must meet consumer demands in order to remain competitive. This means they must pay attention to what the consumer experience is all about and how it is perceived by every individual, and how health plans will be measured by it as reflected in their star ratings and bottom lines. Today, we will discuss how you can meet these demands by elevating engagement and offer an optimal member experience. And we will do this by showing you results from two surveys we completed from Medicare consumers and agents who sell to those end users. We're very excited to present our 9th annual Voice of the Medicare Consumer Survey results, having surveyed nearly 20,000 healthcare and Medicare consumers to date regarding their shopping and enrollment behaviors. We use this data to help with our development activities and provide our healthcare audiences with insights to better connect you to your end users. We are thrilled to present some interesting findings from our Voice of the Agent survey as well, as we uncovered what matters to agents today, tools they are using and not using, and barriers to their own success, among others. I'm Jason Schmidtkins, account executive at ConnecturRx on our agency and multi-carrier team, and I'm here with Amanda Woodman, sales executive with ConnecturRx, who focuses on our health plan segment. In 2019, we introduced the term digital Medicare as a means of proactively responding to a changing world. Nothing could be truer today. Today, we will talk about how today's senior is fearing less and demanding more than the senior in 2020, who is in the throes of a new way of living in pandemic times. We will look at what agents had to say about their challenges and why transforming digitally is quickly becoming critical to their success. We'll discuss key touch points of the member journey and demonstrate proactive versus reactive strategies to engage members. And finally, we will examine why an all-access distribution network is critical to bridging the gaps between health plans and the agencies who are selling their plans. Getting people connected is more important than ever now, whether that be in person or online. And now I'll pass things off to Amanda.
Thanks, Jason. I'm going to give you a few words about ConnecturRx. We've been around since 2000, and if you are familiar with us, you might know us better as DestinationRx. In 2013, DestinationRx was acquired by Connecture to add Medicare and drug transparency to our overall product suite. And so today we go by ConnecturRx. As a software company, we provide both SaaS and API solutions to health plans, multi-carrier organizations, agencies, and pharmacy benefit managers, all with the goal of pairing beneficiaries with their best fit Medicare plans. Our experience and expertise with therapeutic interchange, drug comparison technology, and analytics also allows health plans to improve the customer experience by connecting members to lower cost drug options proven to increase medication adherence and elevate star ratings. We have the largest distribution network in the industry, one that offers an easy way to connect health plan products to agents and agents to the products that they sell. And our proven retention strategies enable our customers to create personalized messaging that leads to brand loyalty as members undergo potential changes in their insurance coverage. And we pride ourselves on being the gold standard in the industry for drug pricing, as many of you may already rely on us for our pricing expertise. We leverage plan data directly from our carriers and always source prices at the pharmacy level, updating our pricing data every 2 weeks and never using regional averages. So let's look briefly at the differences between the senior of 2020 and the 2021 senior that is emerging today. So even though we are now well into 2021, it's important to look back a year, and 2020 was arguably one of the most difficult years in recent history for many. It changed lives and daily routines so many people previously relied upon. And it was especially tough for those 65 and over who accounted for 80% of COVID-19 deaths in the US. Last year, seniors felt fear and uncertainty, They face physical and emotional struggles, isolation and boredom. As their in-person world faded away, their digital presence emerged along with the need for social connection and to get the business of living done. Those who were employed were not able to see a clear path to retirement, and that's only assuming they were able to keep their jobs. Retirement funds dwindled, and their view of retirement certainly changed. And seniors' ability to connect digitally to better understand their Medicare plan options became critical. They had many questions and reached out via their phones and online for answers, and they were desperate to trust in the information that they received. The new year brought welcome changes for the seniors. The senior of 2021 is feeling more in control. The vaccine has brought much hope. Places are opening up, and seniors are reestablishing their in-person connections. Seniors are continuing to use telemedicine and will continue to do so long after the pandemic is over. Seniors believe prescription drug prices are too high and demand to see prices before they pick up their prescriptions. They want lower cost options they can speak to their prescribers about. And compared to 2020, seniors will find it less difficult to get the right information to support their Medicare plan selections. They're more likely to change plans this upcoming AEP, attracted to a wide variety of supplemental benefits offered by MA plans. As the consumer experience rises to a frenzy across all industries, the consumer is indeed driving the bus and starting to feel that positive impact. So here we have a poll. Before we get to the survey results, please take this brief poll to let us know what your focus is on this year regarding member engagement. So what member engagement activities are you focusing on? You can select all that apply. Drug pricing transparency awareness, personalized digital shopping experiences, multi-touch outreach for prescription drug alternatives, providing unique supplemental benefits, or offering a well-integrated provider network and health programs. Every year, we survey several thousand Medicare consumers about their shopping and enrollment behaviors immediately following AEP in mid-December. So let's take a look at who responded to the survey. 66% were women, 34% were men. There was an equal distribution among ages 65, 66, and 67 and over. 10% of responses came from those aged 62 to 64 to understand their feelings about Medicare leading up to their age in year. 74% are retired, 25% still work in some capacity. Most are in very good or good health, and only 6% reported being in poor health. And the majority, 64%, are on Medicare only. Fewer than 20% are on an employer plan, and 10% are on an other individual health plan, such as a health exchange plan. So we've been seeing the same trends that the Medicare industry as a whole has been experiencing with the increasing popularity of Medicare Advantage plans. In fact, in a Fierce Healthcare article, MA plan holders spend $1,640 less a year compared with traditional fee-for-service. This means more financial security and peace of mind for beneficiaries, especially since those on MA plans are more likely to be dual eligible and enrolled in Medicaid. In our survey, we saw a 7% increase in MA enrollments in the past year and a 33% increase in MA enrollments across the ConnecturRx platform. And original Medicare Part D and Med Sup decreased slightly. So this brings us to the beneficiary behavior. We asked consumers from which carriers they purchased their health plans from and why. United Healthcare was the front runner with 24% purchasing their plan, followed by 18% who purchased a Blue Cross Blue Shield plan, 13% an Aetna plan, and then 11% a Humana plan. These are the jumbo health plans that we all recognize, but I'd also like to point out that 16% of seniors chose the other category, which indicates that they're selecting regional health plans that are offering really competitive benefits, which have an increasing presence in our network each year. And we also dove down a little bit deeper to look at selections based on whether they already had Medicare or if they were new to Medicare. So for those already on Medicare, 61% stayed with the same carrier they had the previous year, and only 14% changed carriers. Some beneficiaries may have been hesitant to change plans due to the uncertainty surrounding the impact of COVID-19 on their coverage. 19% of beneficiaries purchased a Medicare plan for the first time. And of this aging group, nearly half went with the carrier they had under an employer or individual plan. Having strategies in place to create a seamless transition from under 65 to Medicare is crucial, and then nurturing their first year Medicare experience even more so. At ConnecturRx, we know the importance of this and provide insights to health plans with potentially at-risk members, whether they are aging into Medicare, transitioning from an employer plan, or if they're impacted by a plan discontinuation, among other circumstances. So why did most beneficiaries stay with their same carrier? And I think the simple answer is trust. The majority of beneficiaries, 68%, trust their health plan brand and have been happy with them. And as we mentioned before, many adopted a wait-and-see attitude that could lead to a great deal of more plan changes this AEP. Followed at a distant second were 9% of beneficiaries who found the right plan only after shopping around. Broker guidance was up slightly as the reason beneficiaries stayed with their plans in 2020. And there was a small decrease in beneficiaries staying with their plan because their doctors were on the plan. So as health plans offer more of a variety of benefits, they're finding it easier to retain members and keep switching within their own brand. So now let's get into the details of that switching behavior. So what may surprise you is a less expensive plan was not the top reason for switching. Consumers have shifted their view of how many benefits they need and are looking for more of an a la carte experience. There was a 9% increase in switching for more supplemental benefits. And the top supplemental benefit that the beneficiary switch plans for is dental, holding the top spot for 2 years in a row as uncovered by Deaf Research in their 2021 shopping and switching study. Because of the rich benefits, we see that beneficiaries are actually happier with their plans today, which is an 11% change over the previous year. And those who switched plans because their broker guided them to a better fit plan was up as well. So we continue to see the strong influence of broker and agent guidance over the past year. When brokers can easily show the value of a better fit plan, consumers are open to that change. Some seniors switch plans to follow their doctors. Most seniors, actually more than 3/4 of them, in fact, said that they would not consider changing doctors to save money on a plan. And Deaf Research also found that beneficiaries with COVID-19 were more likely to switch plans within the same carrier than those who did not get COVID-19. So when consumers made the switch, how exactly did they do it? With the advent of COVID-19 and the switch to more digital engagement, beneficiaries took to their computers, phones, tablets to learn about Medicare. Outreach via phone and online outlets to compare plans was up across the board. There was a 4% increase in beneficiaries who called an insurance broker to help them compare plans and brands, followed by a 3% increase in those who went to the Medicare.gov website to compare plans, and a slight increase in those who went directly to a carrier's website. Making plan information available through multiple channels is the first step in the right direction, but making it interconnected is the key to conversion. So let's take a look at this element of interconnectedness. 43% of seniors research plans online, but they also rely on their brokers to clarify the information they see regarding Medicare. So our survey revealed a whopping 15% increase over the previous year in those who started searching online and then called a broker or agent to help them better understand those plan options. Even though seniors are increasingly becoming more digital, some remain confused by what they read online and still look to direct mail and other offline information. While the digital transformation is real, we also know a multi-touch approach is necessary to reach every kind of senior. And of interest also is Deaf Research found that 50% of beneficiaries prefer to attend Medicare seminars in person. And as both in-person and virtual seminar attendance decreased in 2020, beneficiaries came to rely more on direct mail to get their information. And I'd also like to add, as a side note, when we talk about interconnectedness, is the importance of omni-channel interaction as the primary way B2B organizations are working today. Even with in-person as an option, consumers are making it clear they prefer a balanced mix of engagement, in-person, remote, digital self-service. The omni-channel was an imperative during the pandemic, and its importance is growing still. It's one of the reasons we focus heavily on this type of interconnectedness between our consumer, broker, and call center channels on our Plan Compare One platform. In fact, while many businesses should be able to fully connect in person by 2022, according to a recent McKinsey article, only 15% expect to be in person, expect the in-person to actually be the norm. And so we always talk about best fit plan, but what do seniors really consider to be their best fit? Beneficiaries said their best fit plan was one with the following: lowest out-of-pocket costs. So there was a 14% increase in those who indicated their best fit plan was the one with the lowest out-of-pocket. And each year, more and more of the population understands there are many factors to cost, not just premium. And one of these factors is drugs. So defining a plan with the lowest drug cost was up 5% since the previous year, with the importance of a zero premium plan dropping 2%. The second is plans with the best supplemental benefit options. So we saw a 9% jump since the previous year. And the third being broker guidance. So 23% chose a plan that their broker guided them to versus only 17% who selected this reason in 2019. Drug pricing transparency and the ability for consumers to get lower cost alternatives is more important than ever. So here are some interesting industry stats before we get back into the survey results. Drug makers increased prices in January and July. Since the beginning of the year, there have been over 800 drugs with price increases by an average of 4.6%. Even with manufacturer discounts and negotiated rates by the insurance companies, the increased list price does impact the consumers. And of course, most consumers don't even realize drug prices have increased due to high deductibles and out-of-pocket costs. And many times doctors don't know these costs either. And as reported by a news outlet in March, a recent study estimated that cost-related medication non-adherence will cause 1.1 million premature deaths among Medicare beneficiaries over the next 10 years. They also mentioned that a bill introduced in April would lower drug costs by overturning a restriction on Medicare's ability to directly negotiate drug prices with pharmaceutical companies and limits yearly drug price increases to the rate of inflation. These proposed changes would also make medicine more affordable for everyone, including those not covered by Medicare and the uninsured. So what we found in our survey was that 53% of seniors now compare drugs and drug prices online, which is up 3% since 2019. And the number of seniors searching online to compare drugs, prices, and seek medication alternatives is increasing on carrier sites. In 2019 and 2020, it makes sense that fewer people went in person to ask a pharmacist. And as drug pricing transparency and the member experience become more important to star ratings, it is the perfect opportunity for health plans to engage members directly by using member drug data to proactively reach out with lower cost alternatives. We offer this through our database RX therapeutic interchange solution. And when it comes time for CAP surveys, members will remember it was their health plan who helped them save money. Lower cost alternatives help improve medication adherence and are ultimately reflected in those star ratings. This tool works in tandem with our consumer self-service option, Drug Compare, where a member can look up drug prices and options on the health plan website year-round, and then ask their prescriber about the options that they find. So to conclude this portion, I'm going to give you some insight into consumer perceptions. Consumers were asked the question, do you trust Medicare? This includes private carriers, the .gov sites, brokers and agents, and the Medicare system overall. And the data shows that trust has risen across the board for all of these groups after notable swings since 2018. Since then, trust in private carriers has risen 10%. And when it comes to Medicare.gov, only 23% trusted these sites in 2018, but that increased to 55% in 2019 and then to 60% in 2020. It's comforting to know that considering the challenges of the last year, especially for beneficiaries, their ability to trust and depend on our Medicare system has gone up. It may indicate they are receiving the guidance they seek and the coverage they expect from their health plans. The other issue at play is beneficiaries are becoming more adept at using personal technology and using self-service to shop and enroll. With this comes increased confidence in their ability to select the right plans and coverage for their own needs. So before passing the torch back to Jason, I'd like to quickly mention that you can download the full consumer survey white paper from our website. All right, now to you, Jason.
Awesome, thank you, Amanda. So now we're gonna shift gears and talk about agents. I thought you might find it interesting to hear what leaders in the insurance industry have learned in the past year. To state the obvious, insurance executives have recognized there's a significant need to transform digitally. According to Deloitte, 48% of insurance executives said that the pandemic showed just how unprepared the insurance industry was to weather the storm. Only 25% said their carrier had a clear vision and action plan. What they did learn was the need to take advantage of data-driven insurance and management systems and marketing automation so agents can learn more about customers and make it easier to build relationships. And since customers expect a more personalized experience, insurance products are becoming more flexible. Automation and machine learning are key. Today, there are so many aspects of insurance that can be automated, such as using Hootsuite to manage social media posts so agents can spend more time pursuing prospects and leads. So last year was our inaugural year for our agent survey. To briefly show the agent demographics of those surveyed, most were over the age of 51, with 31% being in the age range of 31 to 50, and a small percentage under 30. Although fewer younger agents answered our survey, we are seeing younger and younger agents entering the Medicare space and engaging the agent consumer through our direct-to-consumer site on our Plan Compare One platform. Most of the agents surveyed are part of an agency, and about half are in agencies with less than 10 agents. 73% of respondents also indicated they are downline from at least one FMO. So as most agents, about 64% sell across state lines on a regional or national basis. It's important they have the right shopping, quoting, and enrollment platform to effectively serve the senior population. When agents and seniors can't meet in person, they need alternative ways to communicate. The importance of building relationships with seniors is paramount to any insurance agent, and that includes the ability to communicate with them in the way they want to be communicated with, whether that be phone, email, or text. We learned during our own AEP 2021 that 83% of beneficiaries and brokers preferred using the desktop over other devices. This was up 3% over the previous AEP. And we also saw that 13% used mobile devices and only 4% used a tablet to enroll. We found in our survey that 53% of the respondents said they were downline from 2 or more FMOs. This presents a number of challenges for agents. Multiple uplines means multiple enrollment platforms, which may vary drastically from one to another. Agents have to manage multiple logins and passwords. Agents can't see all the plans available or plans licensed to sell in one place. And they cannot effectively manage their book of business from one place. They can't see the carriers in the same place where they can quote, do plan comparisons, enter drugs, and more. So in spite of the pandemic, 50% of agents surveyed indicated that they met in person with a beneficiary. Because of staying with old behaviors, many of these agents may have been reticent to switch to more digital engagement and adopt new technologies. 66% of agents are using carrier-specific enrollment forms. This means they're going to a different platform to enroll based on the health plan. This is an inefficient use of time and makes it more difficult for agents to manage their book of business, which is one of the biggest frustrations that agents have. 23% don't have any electronic enrollment platform and will find themselves playing catch-up this year if they don't. And 15% are still doing at least half of their enrollments on paper. These challenges, however, are why we are here. We are able to solve for these challenges through our technology. The time for the digital transformation is now, and seniors are certainly getting on board with it, and so should agents. Now, Amanda will discuss the targeted solutions for health plans, FMOs, and others in response to what we've learned. Amanda?
So now that we know what seniors and agents have to say, let's look at the health plan customer and the member journey from the health plan perspective. So today, health plans are faced with the challenge of achieving outcomes based on quality, performance, and now the customer experience. Factors that feed into a health plan star ratings. So as such, the pressure is on to create and deliver an optimal member experience at every point in the member journey. And star ratings do matter. According to CMS, 77% of all Medicare Advantage plan members are enrolled in plans with a 4 or higher star rating. So if a health plan cannot hold a 4-star rating, members switch to a higher rated plan. When health plans lose a star, this is an opportunity for other health plans to aggressively pursue those members. Disenrollment is a true pain point for health plans. In order to improve stars, we look at each point of the member journey from acquisition to engagement to retention and set the groundwork for lifelong members with proven nurturing strategies from capture to specific circumstance. So we're not going to go through all the solutions in a lot of detail today, but I did want to provide a brief overview of how we're helping our customers be successful in the Medicare space. So the solution set begins with member acquisition. So having an omni-channel strategy to connect potential members with your plans is key, but it's just as important to ensure those members are enrolling in the right plan from the start. So our Plan Compare One platform and our BrokerLink network allows health plans to maximize exposure and drive increased enrollments across all distribution channels with pretty sophisticated and innovative tools for consumer self-service, the call center channel, as well as field agents. So we're going to do another poll so we can better understand your current distribution model. So what distribution channels do you use to sell your plans? You can check all that apply. Consumer online self-service, captive agents, call centers, external agencies, or paper. So once a member has been acquired, we shift focus to engagement strategies to ensure member satisfaction and the success of that member. So offering insights and analytics across a spectrum of member behaviors so you can nurture the member in their first year and beyond. So for example, our therapeutic interchange solutions take drug transparency to the next level. We provide comprehensive drug data, which can then be used in very member-centric campaigns to lower costs and increase medication adherence. And lastly, we have our best fit plan analytics, which support various member campaigns such as post-AEP disenrollment reviews, product conversion strategies, and commercial to Medicare transitioning. And then we have a complementary retention suite, which provides a personalized shopping experience that allows those members to compare their current plan and medications to the upcoming plan year options. So all the solutions mentioned can be drivers in raising those star ratings, the overall member experience, decreasing member complaints, improving medication adherence, and positive CAP surveys. So thank you so much for attending the webinar today. Before we get to the questions, I just wanted to point out our contact information is on the slide. At any time, feel free to reach out to marketing@connectur.com or visit our website, and that's where you can find our latest white paper, Health Plan Solutions that Impact the Member Journey, and more details on each of our solutions. So I'll hand it to you, Sean, to manage the questions.
Great, thanks, Amanda. First question is for you. Do you provide insights and reporting into consumer behavior once they are members?
Yes, absolutely. So we have a lot of different modules that will provide the insights and the analytics that you need to get to know members. So, you know, that's everything from the shopping behavior, so behavioral metrics in a dashboard. So things like, you know, are they, you know, what type of devices are they using? How many times do they come to your site? What does their behavior look like when they're looking for a plan? And then we have transactional data as well. So, you know, providing a deep dive into enrollment specific behavior and, you know, what enrollment looks like across plans with a lot of different data points and ways that you can slice and dice that. And then we have our really comprehensive analytic type solutions like we talked about earlier. So Database RX that, you know, does a deep dive into therapeutic alternatives for high cost drugs. And then our Plan Smart module as well, which can really dive deep into a current member base and give insight into who may need to switch plans or if there's a better plan available for them. So a lot of analytics that we provide.
Got it. Thank you. Next question is for Jason. Can you explain more about your distribution network and how health plans can connect with FMOs better? What does your national coverage look like?
Yeah, absolutely. So we currently work with about 70 multi-carrier FMOs, IMOs across the country, ranging from, you know, large national organizations to state and regional companies as well. So we power, you know, obviously the direct-to-consumer approach through those agencies, as well as their broker channel and call centers. So really a wide coverage across the country of all different sorts of organizations on the multi-carrier segment that we're working with.
Okay. And another question for you, Jason. How many carriers do you work with today as part of your distribution network?
Yeah, absolutely. A great question. Today we're working with about 160 carriers. So that would be inclusive of, you know, MA, MAPD, PDP, and med sub carriers that are on our platform with access to our multi-carrier network as well.
Okay. And Amanda, a question for you. What has been your most successful proactive outreach strategy?
I'm guessing this question is maybe related to, you know, Database RX or some of our engagement solutions. So I can give an example on that. And for one of our larger health plans, we provide our Database RX data set, which is the lower cost options, therapeutic alternatives data set that I was referring to earlier. We provide that to them on a regular basis, and then that complements their outreach strategies. So they do a lot with that data, but I can just give you an example of one of the things that they do is a direct to member text messaging campaign. So that data is actually funneled through their marketing team and down through that campaign into text messaging, and we've seen a lot of success in conversion with that. So,
got it. Thank you. Amanda, Jason, any final insights that you'd like to impart on the audience before we wrap up today?
Just want to thank everyone for their time this afternoon, and thank you to the team here for having us as part of this webinar series. You know, we really appreciate that. As always, you can reach out to marketing@connecture.com with any questions, or directly to Amanda or I if you do have any questions as follow-up to this presentation this afternoon.
Great, thank you. Well, big thank you to both of you today. Thank you to Connecture. Thank you to Jania and Dominion National. Thanks to all of you for joining us today. We are going to wrap up our discussion. Just a reminder, folks, the webinar has been recorded. You'll receive an email with a link to the video so that you can view it again. And to get additional information on how your organization can speak or sponsor, please visit wcwebed.com. Thanks again for joining us. Have a great day. And this now concludes today's discussion.